from the last time we were here to limit the number of fried things I took in
Are you
during
sure?
Christmas. I tried.
Are you very sure?
No, but I tried.
This-
There's a difference between I tried and I didn't.
I didn't. Okay, the truth is that if you begin to do this now, the outcome of learning will manifest in the next few months. You will see it immediately. So you better do it.
Thank you very much, Doc.
Yes.
All right, so we're just going to be taking, continuing from where we dropped off the last time, and that was hypertension. But cardiovascular
Cardiovascular disease,
But
yes.
before we go into that, I would just like you to brief us one more time on what goes on in Diet and Health Foundation.
Okay, what goes on in Diet and Health Foundation? Diet and Health Foundation has come to stay, and it's indeed a hope for the hopeless. What I mean by hope for the hopeless is that there are a number of persons who have lived on drugs. Okay, they've lived on drugs for the past 10, 15 years and above. Now, coming to Diet and Health, we're able to tell them that you can drop these drugs with food. As a dietitian, I'm ready to take any patient by the hand. Okay, escort you by the hand. As long as I'm willing to follow the protocol, and then we arrive at our destination. What's our destination? Our destination is you will conveniently put down your drugs, and then eventually recover your health, and then return it. The objective now is, number one, you pull down the drugs. Number two, recover your health. And then number three is to retain your health. So this is what we do for a number of persons who come to Diet and Health. So we're here to assure you that with food, you can do a number of things for yourself. Because we've come to understand that most of the health challenges we have are born out of, poor lifestyle, poor dietary intake, and all of that. So the moment you're willing to make right the wrong, and then follow the pathway to good health, certainly you're going to get back your health. So in Diet and Health, we teach you how to eat well and recover your health. Teach you how to eat well, recover your health, so that you can conveniently get, out of the problem of hypertension, diabetes, heart disease, ulcer, asthma, and the rest of them, arthritis, overweight.
It's funny that you brought in asthma, because that's where I was actually heading
Okay,
to.
you're going there.
Yes, because I was going to ask you, this diet helping the health, does it work for every illness? And I'm asking that because earlier I had a health program and we're talking about asthma, and the professionals in the studio mentioned that it cannot be cured, but it can be maintained.
Can be managed.
Yes,
Okay.
it can be managed rather. So when you're talking about the fact that your diet can help different illnesses, does it work for everything?
The truth is that if you did not try diet, you will not understand the world of food. So I challenge anybody who says, food doesn't cure many diseases, to come with one illness. Okay, I challenge. And I thank God I'm in Uyo. I'm not coming from Aba. I'm not coming from Lagos. I stay in Uyo. I'm in Uyo for the past 5 years. Okay, so for asthma is respiratory disease. Now, in food, there is what we call a bronchodilator. Asthma is a condition that affects the bronchitis. Now, there is something we can give you in food. Okay, let me mention it. Chlorophyll, in specific, is a bronchodilator. I know a way I can give you chlorophyll with time. Asthma will disappear. And then in addition to chlorophyll, there are some other things too you can take by way of food, and you disappear. The asthma disappear. Honestly, my wife used to be an asthmatic patient, my wife in particular. Because you see, if I cannot cure myself or heal myself, why will I talk about somebody else outside? And number two, she used to be highly hypertensive. Today I'll be talking about hypertension too. For the past 3 years, no more drugs. I'm talking about hypertensive drugs. No more. She lives with her BP ranges between 120, 75, 80, and 85. No more drugs. Is it not cured? No, the medical science wouldn't want to hear this because they want you to bring the claims. But I'm telling you, food can help anybody who is willing to follow the protocol. Because we're talking about diet here. It can help anybody. So Maybe if you have anyone with asthma, give it to me.
I'm quite interested in
Yeah,
that because
give it to me.
they actually broke down how it cannot be cured and it's a genetic issue and all of
Yeah.
that. So hearing that diet can help is
Diet
quite
can help.
encouraging.
Diet can help and can actually reverse it, honestly.
Interesting.
Diet can help. So in Diet and Health, we help you, teach you how to eat your food as medicine. Because the food we eat as medicine. Honestly, if food can grow us, make us mature, so what do you think food cannot do in our body? Most of the sicknesses we suffer are as a result of poor dietary intake. So when you take food, okay, let's look at a case like hormonal imbalance. What do you think that causes hormonal imbalance? Do you think it's witches and wizards? The answer is no. It is simply how you eat your food wrongly. And so the moment you begin to eat your food fine, okay, things that were not proper in your body system can be corrected and proper balance. Your body can assume proper balance position. So who is to blame now? You are to blame. So the very day you make up your mind and say, okay, I want to eat well, and you begin to eat well, guided by a professional dietitian. Not just you make up your mind, okay, I want to eat this today, I don't like this one, no, I like this one. No, it doesn't go like that way. Whenever you want to go diet, all the way, you listen to your dietitian, will take you, and by the time you open your eyes, you're already at your destination. You'll be happy. We have testimonies of numerous people who have had these things we're talking about today. They are normal, including tuberculosis.
Interesting.
Yes. So these things can be done with food.
But how can we contact you though?
Okay, you can contact us on the number 09068205671. 09068205671. Our office is number 4 Udememos Street, off Vision Road, in Sukarafort. Sukarafort is close. Our office is close to the University of Uyo Main campus. Okay, once you get there, you're already there in our office. 4 Udememos Street, off Vision Road.
All right, so let's just move straight now into the issue of the day,
All right.
and that's cardiovascular diseases. We spoke about some of the cardiovascular diseases last week, and we promised to talk more this week. So we're still talking about the types of diseases.
Yes, I want to take time again today to explain a few other, when we say cardiovascular diseases, there are a number of conditions with which you can describe the condition of the heart. It is not just a straight issue. Medical science has done a lot of researches and have discovered a number of conditions that can affect the heart. So last week I talked about what we call valvular, heart disease, and I also talk about coronary artery disease in the last week program. And then I went ahead to talk about claudication in the last week program. Talk about congenital heart disease in the last week program. But today I want to continue with arrhythmia. Okay, arrhythmia. I will not want to explain again because I did explain how these things affect the heart. But with arrhythmia, arrhythmia is a fluttering, pounding, or racing feeling in the chest. Anybody who has any kind of heart disease, it begins with, chest is paining me, chest is paining me. You will hear this from more than 90% of those who have heart disease, okay? And then it's also characterized by a fast heartbeat. I'm talking about arrhythmia now. A fast heartbeat and a slow heartbeat, kind of going up and down and all of that. Okay. Chest pain, and then it comes also with what we call shortness of breath. These conditions are what we may call, although there are other heart conditions that may behave in a similar manner, but that these are the symptoms of what we call arrhythmia.
But these are also things that the things I just mentioned now. There are things I also notice when you finish like a long race or something.
Yes.
Your
because
heart is beating faster. Your shortness of breath.
You're pounding.
Yes.
And all of that. Yes, that is
okay.
Simply because you were in a race, or you were doing a hard work, or you were like this morning when I did my road work. climb a hill. I was coming from Idu back to Zukara. I was
Wow.
running and climbing that hill. That was how my heart was pounding. But that one is good because it increases the rate at which your heart pumps. Okay? That one is different from an ordinary situation where you are not working, you are doing nothing, and your heart is racing. Your heart is going up and down. So it's different from that. This one, you are working, and then your heart increases the rate by which it was pumping, which helps the heart at that particular time.
Okay.
Yes, so let's look at carditis. Carditis, or what we call inflammation of the heart. Okay, most conveniently broken down into 3 categories, which are pericarditis, that is inflammation of the pericardium, and then myocarditis, the inflammation of the heart muscle, and then endocarditis, inflammation of the endocardium,
Are you going to
and
break
so on.
down the
Yes,
pericardium?
yeah, all those things. Like, there's nothing to break down here than you just know that in the heart, like this case now is divided into 3 sections. A pericarditis, there is no other language I can use it. But that an average man who has the heart condition, I'm not talking about the scientist now. Sorry, I'm not talking to the scientist now, or the professor, or the doctors. I'm talking to somebody who has high blood pressure. I'm talking to somebody who has diabetes.
Are you saying that anyone that has high blood pressure knows
Has heart disease?
What pericarditis is?
No, he doesn't know. He doesn't
That's why
know.
I'm asking for you to break it
Okay,
down, so anybody can understand.
Okay,
that.
now what we say. Let me talk the symptoms now. The symptoms are equally the chest pain. You will also experience chest pain. You will also experience fatigue. And then sometimes swelling of the legs, ankle, and feet. These are the conditions, the symptoms of what we call carditis. I told you the carditis are divided into these diabetes. When we say T in the medical language, it shows inflammation. There's a sickness in that part of the body. So that is what I think. Then the person will experience fatigue, swelling of the legs and the ankles. You've seen people whose legs are swollen. You look at the lower limb, you touch, it depresses, swollen. That is a sign that something is wrong with the heart. Okay? Something is seriously wrong with the heart. Sometimes it could be rapid or irregular heartbeat, like in the case of arrhythmia. And then shortness of breath, as if the person going to pass out. Suddenly feel that the breath is, almost passing out. And then at rest and during activity, such person, you cannot subject him or her for exercise. Like I told you, I was in a road walk or jogging this morning, and then such person, you cannot ask him or her to do a road walk or jog, but he can do a brisk walk. Okay, so because the heart is, even at resting heart, it continues to rest. And then another one is mitral valve prolapse. Mitral valve prolapse. That one is improper closure of the valve. The heart has to do with valves. There are valves in the heart. Sometimes one of the valves might close and never opens again. That is a very serious heart condition.
What causes that?
It could be depending on the severity of the leak into the left atrium. There's a right atrium and the left atrium. So when there's a leak into that atrium, and then during systole is when we talk about systolic reading and the diastolic reading, where your blood, the up region, the up the up reading and the down reading. Now, when there's that leak, it might cause this problem. Okay, then the third one is cardiomyopathy. This is an acquired or hereditary disease of the heart muscle. This condition makes it hard for the heart to deliver blood to the body and can lead to heart failure. The heart pumps blood. When the heart pumps, it pumps to the extremities of the body. It pumps to the brain, pumps to the leg region, pumps to the heart. As I'm talking now, my heart is working. Never a time your heart stops pumping. Whenever the heart stops pumping, for an average man, that person is gone. That means there's a failure. So it does that pumping on a continuous basis. Okay, so if anything happens and it slows down and it doesn't pump, That's the beginning of a problem of the heart. So it is important to make people understand when they have different, symptoms in their heart, contrary to what they used to have. That is to begin to note that something is about to happen to their heart. And that is when to take a proactive action. So in viral infection, like in the case of cardiomyopathy, sometimes it could be as a result of viral infection or and other congenital issues like that. Congenital, we're talking about the person was born with that condition.
Okay.
That is why it has a relationship with a genetic problem, predisposition. Okay, so now another one is embolism. Embolism is another condition of the heart, and then a condition in which one or more arteries in the lungs become blocked by a blood clot. This one actually leads to stroke. When you hear somebody have stroke, most times pulmonary embolism is caused by blood clots that travel from the legs and rarely other parts of the body, deep vein and so on. So it is the symptoms include sudden shortness of breath. You could see that all these problems of the heart I've mentioned, there is one single denominator. That single denominator is shortness of breath. Okay? Pain in the heart. Okay, so if there is pain in the heart, it means there is a problem. Now, it could also be irregular heartbeat, and then palpitation, and then coughing. The person can start coughing and all of that. So it could be swelling, and so on. I think at this point, let's okay.
All right. So at this point, let's still open the phone lines, right?
No. We'll open open one or two calls, and then after we'll go and continue.
All right. So if you'd like to ask your questions to the doctor, the dietitian in the studio, to find out what you need and for cardiovascular diseases, the phone lines are now open for you to call in, and the phone numbers are 0803 085 7755, 0803 085 7755, or 0809 066 6909, 0809 066 6909. These are the numbers to call. But Doc, while we wait for the calls, right, I'd like to know, you mentioned a couple of symptoms that are
Associated with
common.
Yes.
With the
Heart
different
disease.
yes, the different heart diseases.
Yes.
But are there some that might be peculiar? Before you answer that question, let's just get this call.
Okay.
Hello, good evening.